student panel informative and beneficial. For our very first workshop, we have Ms. Rosie Walker. She will be presenting on behalf of AACP and the PharmCAS application for tips on a successful application submission. Everyone, please welcome Ms. Rosie Walker and give her a warm round of applause.
Thank you. Well, good morning where you're at. It's well into the afternoon here in Washington, D.C. But thank you so much for having me be a part of this event. I actually look forward to traveling out to California during this time because it's so much warmer out there than it is here in DC now. But I'm just glad to be a part of this virtual event. This is our new normal, I guess, with everything going on. As you mentioned, my name is Rosie Walker. I work with the American Association of Colleges of Pharmacy, and I'm not sure how my PowerPoint's gonna work with this.
Oh, I will be sharing the slides.
Okay, perfect, yeah. And so I am the Director of Recruitment and Diversity, and so I focus a lot on recruitment initiatives focused for underrepresented minority students. So I'll get into the presentation now.
Thank you so much. And before we start, to our attendees, please direct your questions to our student questions speaker, Quay, via chat. If time allots at the end of the presentation, your questions will be asked by them. And for Ms. Walker, please note our timer, Allie, as they will be updating the chat as well as their own Zoom background with 10 and 5-minute markers for your allotted time.
That sounds great. Thank you.
Thank you. And I will be sharing the slides right now. So
perfect.
Without further ado, Mrs. Walker.
Thank you. So if you go to the next slide, this just kind of gives an overview of AACP. Most students are not familiar with AACP until more so after they graduate, but our association represents all of the different pharmacy schools throughout the United States. Congratulations on UCI being one of our newest schools of pharmacy. So currently we have 144 schools of pharmacy throughout the United States. We were founded in 1900 and, like I said, based right outside of Washington, D.C. in Arlington, Virginia. And really the mission of AACP is to lead and partner with our members, who are our schools of pharmacy, to advance pharmacy education, research, scholarship, practice, and service to improve society's health. Our next slide. There are several different marketing initiatives that we have at AACP that may be of some interest when you're exploring different careers in pharmacy or things like that. One of which is our Pharmacists for Healthier Lives. It's really targeted towards adults or families to understand the role that pharmacists play within the community and within the lives of their family. And then the next slide is the Pharmacy is Right for Me website. So this is something that may be more of interest to prospective students, both in high school and in college, that are really looking towards getting more information about pharmacy education and careers. The next slide. There's several resources on the Pharmacy is Right for Me website, such as blog posts where we really can highlight some of the ways that pharmacists have been instrumental in COVID. Do's and don'ts, pharmacy interviews. We have bios of different pharmacists so you can kind of see the day in the life. And then our Campus Corner page, which highlights each of our different schools of pharmacy with a video and visual representation of their school. Next slide. So we get this question a lot in terms of what is it that pharmacists actually do? There's a perception that most pharmacists really just work at a retail store filling prescriptions, but pharmacists do so much more than that. There's a bulleted list of things in terms of patient care, preventing medication errors, actually working one-on-one with patients to take their vital signs, and really just being the expert in terms of the drug and how that drug is going to interact with that patient's body. The next slide. In terms of pharmaceutical care, the care that they actually provide can be anything from curing diseases to reducing or eliminating symptoms, just improving the overall patient's health with the minimal risk as possible, altering drugs to make it easier for patients to do, and then researching and developing new drugs. Next slide. So when you attend pharmacy school, each student, once they graduate, will be capable of performing what's called entrustable professional attributes, or EPAs. And that kind of breaks down each area of your expertise as it pertains to being a pharmacist once you graduate. Next slide. So essentially, if I had to sum it up in one sentence, I would just, well, two, I guess, I would just say that pharmacists are medication use experts. No one knows more about medications than the pharmacist. Next slide. So there are so many different career pathways that you can go into when exploring a career in pharmacy. Next. And one resource that we have on the Pharm for Me website is our pharmacy career quiz, where you can actually go and answer a series of questions, which will generate a career pathway that may be of some interest to you based on your interest. Next slide. So to get to that, all you have to do is go to the pharmforme.org, and then you'll see the drop down from your cell phone. Most of them will use it. And then you'll see the tab for the pharmacy career quiz. It's just a quick 4-minute, if that, questionnaire, kind of some fun questions that kind of ask, what you like to do on the weekend, how do you study for a test, what organizations do you volunteer with, and from those answers, it will generate a career pathway that may, within pharmacy, that may be of some interest to you. Next slide. So when talking about different career pathways, here are just some of the few career opportunities that you can explore within pharmacy. There are nuclear pharmacists that actually create radioactive drugs that cure diseases such as cancer, pediatric pharmacists that work specifically with children because the dosages of drugs that are manufactured are going to be different for their bodies. Compounding pharmacists that actually customize drugs. So giving the example of children, they can add flavoring to make the drugs taste better, or take a drug that was a solid form and make it into a liquid. Ambulatory care pharmacists, they actually work one-on-one with patients, seeing them on rotations just like doctors would do. The next slide. There are cardiology pharmacists that focus specifically on drugs that help with the heart-related issues. Emergency medicine pharmacists, when there are tragic events that occur in the hospital, there's pharmacists right there along with the doctors and emergency medicine professionals to ensure that the drugs and things that are going into the IVs are correct for that patient. There's even psychiatric pharmacists. So in terms of how the drug really interacts with the way that we think and in our minds, and geriatric pharmacists that work specifically with older populations. Next. And then infectious disease pharmacists, that has been really big in terms of COVID now, and even with the Ebola epidemic, there was a pharmacist on the forefront of that pandemic as well. Poison control pharmacists, veterinary pharmacists, and then of course your community pharmacists, which is usually within 2 or 3 miles away from every individual. Is just knowing that community pharmacists do more than just dispense medication, but also administer flu shots and vaccines and things like that. So the next couple slides, you can just go through because it essentially just said everything that I said, but for those of you who downloaded, you'll have those talking points there. So why would you go into pharmacy? Well, one, pharmacy is a well-rounded career, and pharmacists are a vital part of a healthcare team. Anytime you see a doctor, anytime you see a nurse, there's a pharmacist right there working along with them to ensure that patient's best health. There's outstanding career opportunities. As I mentioned before, there's so many pathways that you can go into, excellent earning potential, and pharmacy is still one of the many trusted healthcare professions. Next slide. So now that you know why you want to become a pharmacist, now here's the how that you become the pharmacist. So applying to pharmacy school. Next slide. Essentially, like the process of when you were getting ready to apply for undergrad, the pharmacy school application has 5 key components, which is PharmCAS, our centralized application system, your transcripts, PCAT scores, letters of recommendation, and the personal statement, which I'll walk through now. So PharmCAS, which is managed by AACP, our organization, is the centralized application service that allows an applicant, so allows for you to use one application and one set of materials to apply for multiple PharmD programs. So it's kind of like the Common App, I guess, if you will, for pharmacy school. Next slide. So of PharmCAS, like I mentioned, we have 143 pharmacy schools and 135 of them use PharmCAS. So there are about 10. They're usually small, private, liberal arts schools that may not use PharmCAS. So if you're interested in one of them, you would have to apply directly through that institution. We receive over 43,000 applications and have about 15,000 applicants, meaning each applicant usually applies to a little over 2 schools of pharmacy. Next slide. There's a lot of helpful resources that are on the PharmCAS website that I'll kind of walk through, but listing now. We have a virtual pharmacy schools interview do's and don'ts. Because everything has become virtual now, there are some things that are different from when you did your traditional pharmacy school interview face-to-face. And so we provide some helpful tips on that. There's also a PharmCAS applicant webinar that is sponsored by Liaison. That's our partner that runs the technical side of the PharmCAS application. And they go through the application step by step, bullet by bullet, like as if you were completing the application. So that video is on there too, that literally walks you through every single step of the application, some of which I will just highlight today. There's PharmCAS School Directory. We actually updated our website has a new, more interactive directory page. So when you're looking to, oh my gosh, 10 minutes. Okay. And important dates and tips. Next slide. So that's the PharmCAS school directory video there. It's the tutorial that will actually walk you. It's available on YouTube. And so all of the resources that I listed in the previous slides, we have videos and more interactive activities available to utilize them. Next slide. So breaking it down into just 4 tips. One, I would say create your PharmCAS ID number, utilize the PharmCAS school directory, read all of the instructions and make sure to check your email regularly. Next slide. And then that's just a full checklist that's available as well, in addition to the videos. Next slide. This is the portal of when you log into the PharmCAS application. You will see there's a section for your personal information, your academic history, all of your supporting documents, and the program materials, which are supplemental materials that different schools may ask for. Next slide. I just wanted to highlight a new section on the PharmCAS website that does indicate, that does pertain to the impact that COVID has had on your application, and in terms of your curriculum and your transcripts and things like that. So they do take some COVID implications into consideration for this new cycle. Move forward. Next slide. So with those sections, these are the different things that are central to the PharmCAS application in terms of your application, your transcripts, your PCAT scores, custom questions, and then the supplemental documents are things individual to the specific pharmacy school that you're applying to in terms of supplemental materials, additional fees, and other tests or documents that may be required. Next slide. So with your official transcripts, you have to have a transcript from every institution that you attended, and no student issued transcripts, so you can't receive the transcript from your school and then send it to PharmCAS. And be mindful that the transcript deadlines are not enforced in PharmCAS. We'll go more over deadlines in just a moment. And then any updates to your transcripts such as your spring or summer classes, you'll have to send those in when doing academic update and use electronic transcripts whenever possible. Next slide. Also, Canadian transcripts do not need to be interpreted if they're in English. Next slide. In terms of your international coursework, these are the agencies that you use to get your transcripts evaluated and then sent into PharmCAS. Next slide. PCAT, I know that a lot of schools in California don't require it, but I just have the information there if you're looking for schools outside of it in terms of the test itself and the cost. Next slide. And next slide. Those are just a breakdown of what's on there. But these are where you would actually send your PCAT and TOEFL scores to. Those are the codes specifically related to PharmCAS. Next slide. But each school has a policy for PCAT and TOEFL. As I mentioned, there's a lot of schools of pharmacy that do not require PCAT scores or TOEFL scores. And so once you look in the school directory, specifically for that school, you can see those policies as it relates to that. Next slide. Your personal statement. So the personal statement that you write for your application should really just address why you selected pharmacy as a career and how the Doctor of Pharmacy program relates to your long-term and professional goals. You want to use your own experience in terms of your personal, educational, and professional experience. And just one tip, sometimes it's easier to copy from Notepad and then place into the application. Next slide. Your references, you have the option to enter up to 4 references, even though the specific school you're interested in may only require 2 or 3. Next slide. And this is an example of the reference grid that is given to your recommender when they complete the reference for you. Next slide. And then once again, you want to check specifically the policy for the school that you're interested in because they will have different requirements for the number of references that are required. Next slide. So before you submit your application, just make sure you review it for accuracy, pay all the deadline fees, and then print and save a copy for yourself. Next slide. And those are the fees as it pertains to how much it costs to apply to pharmacy school. It's $175 for your first school of pharmacy, and then $55 for each additional school after that. And you can apply to as many schools as you would like. Next slide. And then that's how there's a little button there because a lot of students miss it to save your print your application. Next slide. And then there are some other fees related as it pertains to the criminal background check and drug screening that will be required after you're accepted into pharmacy school. Next slide. If you have any questions about PharmCAS, that is the number and information that you can call. Next slide. Some important dates to consider. Next slide is these are some dates to remember. Just to highlight, June 30th is the very last day to submit applications for this cycle. So if you are wanting to start pharmacy school this fall, June 30 would be the last day for that, even though some of the deadline dates have well passed. And then July 14th is when the PharmCAS application opens for next fall. Next slide. Okay, so PharmCAS profile. In terms of UCI and how students compare to all of the other students that can apply to pharmacy school, this is just a breakdown of UCI over the past few years. You can see that you have a very high acceptance rate, which even increased more over this past year to 97% of the students that apply were actually accepted. Next slide. This is a breakdown of gender as it pertains to our overall applicant pool. So it's pretty even in terms of male and female, in terms of UCI applicants and all of the PharmCAS applicants. Next slide. This is a slide as it pertains to race and ethnicity. You can see in the blue, those are the race and ethnicity breakdown of UCI students that apply to pharmacy school. And then in the blue teal is overall PharmCAS applicants. So you can see some areas are pretty consistent, and then some areas are well exceeding the norm for PharmCAS. Next slide. In terms of citizenship, very similar to UCI students as well as all PharmCAS applicants. Next slide. And then in terms of GPA, UCI students do edge out our overall PharmCAS pool. You can see that the average GPA for all PharmCAS applicants is about a 3.05, whereas UCI students are 3.17. Those are the students that apply and the ones that have been accepted. Next slide. Next slide. And oh, good. And if you have any additional information, you can feel free to reach out to us on website, via social media at Farm4Me or at PharmCAS or any of the links listed below. Thank you. I'm sorry. I hope I didn't rush too quickly. Time goes by so fast.
Hello, Ms. Walker. I would just like to thank you for your very comprehensive overview of what the pharmacy profession entails and also the PharmCAS process. And I do have a question here from one of the students asking, when does the PharmCAS open for the 2021 to 2022 cycle?
Yes, that would be that July 14th, 2021. So this summer, the application will open.
Thank you very much. And I have one more question regarding, will we have access to these slides after the conference?
Yes, absolutely. That's why some of the slides have more writing on it versus some of the pictures, but yes, you will have access to the slides. And there are links to a lot of the information that I listed in the slide in the comment section of the PowerPoint. So you can go directly to the training videos and directly to the other resources.
Well, first of all, I just really like to thank you for taking the time today to educate us. It's going to be instrumental when it is our time to apply. So thank you very much, Ms. Walker.
Thank you. And as I mentioned before, and anytime you have any additional questions along the way as you're starting the process or even thinking about the process, feel free to reach out to myself or anyone on my team at PharmCAS or Farm4Me.
Thank you. And I was wondering if we could get another warm round of applause for our panelists. Ms. Walker, please.
Thank you. Thank you all.
And as of this time, we will be taking a 10-minute intermission. So please feel free to stretch and use the restroom if you need it. However, please make sure that you return to your next designated workshop Zoom meeting at 11 a.m. seen on our itinerary that we've provided. So thank you for being here today, guys.
Thank you so much, Ms. Walker. Always a pleasure.
Thank you. Bye.